V rolling.
Is rolling. Do it. Whenever you're ready.
This is Thinking Positive, a series of interviews marking the 25th anniversary of the Canadian Foundation for AIDS Research. CANFAR, one of the members of the Scientific Advisory Committee, is Dr. Trevor Hart, who's doing some really interesting psychological scientific research into HIV and AIDS and men who have sex with men. What is it you're looking at, and what is it you're finding?
Well, most of the research that we're doing is taking a look at what makes people at risk for HIV among people who are from higher risk communities like gay, bisexual, and other men who have sex with men. And then also to create programs that can help to promote sexual health and reduce HIV risk so that we can prevent new cases of HIV.
And what are you finding? Are you finding that people are taking the risk of infection less seriously?
Well, we do have some evidence that there's some people have beliefs that HIV is less serious or isn't that easy to transmit. And to the extent that you have those beliefs, the more likely you are to think it's not a big deal to have unprotected sex.
Well, what do you hope the result of your research is?
Well, the goal of my research is kind of twofold. The first one is to prevent new cases of HIV, and for people who are living with HIV to help them to live a healthy and positive and pleasurable sex life and mental health as well.
So people, I guess, don't really think of the psychological element of HIV and AIDS.
Yeah, it's kind of funny that they don't, because that's actually how you get HIV, is through the main thing that psychologists study, which is behavior. So, you know, HIV isn't contracted by chatting with people. It's not contracted by even touching a doorknob like a flu is. It's through unprotected sex, sharing needles. That's the major ways that people are transmitting HIV in Canada. And those are very psychological. That's things that we study regularly: drug use, sexuality, and things that aren't necessarily problematic either. Like having sex is not actually problematic. It's just having unprotected sex with someone when you don't know their HIV status could lead to some problems, including in Canada.
But the hard thing is changing human behavior, though. I mean, nothing's harder to change than that, maybe people's minds.
There's actually a lot of work that's happening that we're doing to promote sexual health and to reduce HIV risks. And that's a big part of what we're doing, is trying to develop programs that people will actually be interested in, be engaged with, and not feel judged, and feel like that they're going to walk away getting some positive benefit out of it, and benefits that will protect society as a whole and protect people who aren't living with HIV.
Once people are infected with HIV, what happens psychologically? I mean, are there any patterns that you're aware of now?
Well, one thing that we know is that there's a big problem in our society with HIV stigma. And HIV stigma is kind of when people are feeling judged or feeling like that they're less than because they have HIV. And typically in Canada, the way people are getting HIV is by having unprotected sex. When in reality, if you don't have unprotected sex with somebody or share needles with somebody, it's nearly impossible to get HIV from somebody else. So HIV stigma is a real problem. People are concerned about who they can tell. People are concerned about being rejected from family or friends, even having trouble at work. And so that really can lead to a lot of distress that people with HIV can have.
How significant is the Legacy project that CANFAR has?
Well, the Legacy project is a really important project of CANFAR. CANFAR has really taken a lead in kind of integrating gay and bisexual and other men who have sex with men in HIV prevention. So much of the research has been about finding a cure, and that's really important, and that's one of the reasons why CANFAR was founded. But until we find a cure, we need to find ways for gay and bisexual men to kind of be integrated into HIV prevention, and to also use the resources of the community, including financial resources, to fund research that can prevent new cases of HIV among gay and bisexual men who are really still quite at risk for HIV.
And figure out the proper messages to prevent people getting it in the first place.
Exactly. So, you know, there's a lot of societal work that needs to happen. The work that we do is typically one-on-one, or it's with small groups. That's only a part of the solution. We need societal change too. We need to fight against HIV stigma, and that's why CANFAR and its campaigns are just so important, because those are campaigns that are for everybody, reaching young people, reaching adults, and saying, you know what, HIV is still a problem in Canada, and that's one thing I really admired CANFAR for doing.
Thank you so much.